Shifting focus now, as India grapples with the third COVID wave, Max Healthcare Hospital has conducted a study on the patients admitted during 3 different waves. Now, it is also talking about how vaccination helps in lowering the chances of hospitalization, and have big metro cities really like Delhi and Mumbai already surpassed the third wave peak. My colleague Ayushman, in fact, spoke to Dr. Sandeep Buddhiraja from the Max Healthcare Hospital. Listen in.
60% of people who died because of COVID this time were those who were either unvaccinated or partially vaccinated. So that goes to say that vaccination is protecting people from getting hospitalized and getting a severe disease. Now, this is a big contrast from what we saw in wave 2. In wave 2, we did have a significant number of young people, adults dying, people without any comorbidities. I remember 40% of people last time had no comorbidities. This time we have not seen that. So practically everybody who has died is elderly with multiple medical problems, partially or unvaccinated. So this is the risk population this time. We also saw that overall mortality was much less this time as compared to last time 10.5% in hospital mortality. This time it was about 6% in hospital mortality. Yes, we did see significant, and we still have significant number of patients in ICU, although the wards are now almost empty. Whereas in the peak during the second wave, the hospitals were overwhelmed. 70 to 80% of the people who were in the hospital were on oxygen or required oxygen last time in wave 2. This time, hardly about 20-25% people who are in the hospital require oxygen. So that goes to again show that people who even were hospitalized this time had overall lesser severity disease, because we know that Omicron generally does not involve lung as badly or as severely as the Delta strain used to. But at the same time, the good news is that in bigger cities, bigger metropolitans, Delhi and Mumbai, the peak is over and we are now already in a downward trend. We are clearly seeing this for the last 4-5 days. The number of outpatient and the number of admissions happening in the hospital both have reduced significantly over the last 4-5 days. ICUs are still occupied, but as you know, the ICU patients take longer time to get discharged. So their overall stay in the hospital is much longer. And hence we still have some occupancy in the ICUs, but overall there is a decline. And the way it is going, I think in coming few weeks, we can expect the situation to normalize, at least in the bigger cities.
Slipping into a very short break with that.